Good morning. We are here at Georgia Pain and Spine Institute with Dr. David Webb, double board certified physician, brand new practice here in Decatur, just outside of Atlanta. And we're going to talk a little bit about your practice. It's brand new to the area. Tell me a little bit about the vision that you have for Georgia Pain and Spine Institute.
Well, thank you, Dan. Thank you for having me. So, the vision for Georgia Pain and Spine Institute is to be the premier interventional pain management practice, not only in the state of Georgia, but worldwide. We have a vision where we would like to be able to encompass all aspects of treatment of chronic pain. And our belief is that if we first identify the cause of the pain, that will allow us an opportunity to better treat the pain. We incorporate many different modalities of management of pain, that including implementation of therapeutic treatments such as physical therapy, chiropractic management, water therapy. We also have a multimodal approach where we incorporate interventional treatments, those treatments being injection therapy. For those individuals that may not be amenable to certain injections, there's what we call PRP. There's also other treatments that are on the horizon that can be beneficial, and we just want to be able to offer all of those different types of treatments all across the board.
So this is designed to be more of something that gets people away from having surgeries and treating, or maybe even people who've had surgeries who maybe still are in pain because of that. My feeling is that you're wanting to get people away from the traditional let's cut and paste and move more towards let's get you well without doing that.
Yes, definitely. We want to embody a functional approach to treating pain rather than the overall traditional. If you have pain, we treat it with medication, or we treat it with surgery. If there are so many different types of different ways that pain can be treated now, and as we continue along with different technological advances and the advancement of science, we have discovered that there's no one individual is like the other. So we definitely would like to have you come in and have a consultation and be able to discuss some options to treat the pain.
And I get the feeling that coming into this space is a little more, I feel more of a family atmosphere here than I feel that doctor's office kind of thing. I know a lot of people complain about, I feel like a number on a page, I sit in the lobby for 9 hours to be seen for 9 seconds and all that. And this has a very different feel. So tell me about your vision for the patient's experience.
Well, me being from Stone Mountain, I always said I wanted the opportunity to come back home and to be a part of the process of taking care of the city that raised me. With that being said, being down in the South, we are a family-oriented, patient-centered type of practice. From the step into the front door, our clients are greeted with a warm smile, and we like to say we're all family. We treat everyone as if they were one of our own. And so I hope the opportunity, if it does present itself, you could come down and visit our facility and see what we have to offer. We have a front desk that's exceptional, that will help you in every aspect of the way. We work closely with other offices and physicians that you may have been a part of. We discuss our findings, we obtain information, and we try to get all the documentation before you come in. We try to make sure that the process is streamlined, so you won't have to spend as much time filling out paperwork or getting in the back to have the opportunity to be seen and to be evaluated.
Any sort of procedures that you do, everything is done in-house, correct? We're not having to deal with hospitals and all that mess, right? You guys do everything here from a procedure standpoint.
Correct. Yes,
Okay.
we have what we call an in-office procedure suite, where we offer state-of-the-art facility that you would also normally get in a hospital. We have what we call a C-arm that allows us to perform fluoroscopic guided procedures. For those procedures that are not warranted. We also have other modalities to incorporate and to be able to provide treatment. We have an in-office lab which allows us to perform our PRP stem cell procedures. And I like to say that even though we're right across the street from the hospital, we are definitely not the hospital. And so we hope that when you get an opportunity to experience that, that you will say the same.
Yeah, I don't think anybody likes going to a hospital anyway.
Not at times it is necessary, but for what we do, we hope to be able to provide an outpatient setting for you.
So, and from a pain standpoint, you do some pretty unique things with cancer patients, correct?
Correct. So, going through cancer treatment or having been through cancer treatment is a significant experience, to say the least. There's so many types of emotions that one goes through during that period of time, and we would like to be able to provide a means to help facilitate getting through that process. If that's in a form of being able to prescribe or provide different types of treatments or medications that may be needed to help with some of the side effects due to treatment or current treatment. And more so, if we could just be here to be a voice for someone to listen to. We have all our individuals on site have the ability to be able to sit down and talk with you and be able to help you get through some of the treatment that you may be going through.
Yeah, compassion, I think, is a big thing that gets lost in a lot of places. Again, it's that number on a page. People are treated like people. They're treated like the problem that they have, right?
Unfortunately, yes. But we like to treat you as an individual. Everyone, we get to know your name, and we like to say once you are a client of ours, we're family for life.
Love that. I love that. What's your favorite thing to treat?
Favorite thing to treat would have to be what we call failed back pain syndrome, or pain after surgery. There are many different treatments for individuals that experience this. Surgery always is not I wouldn't say the final answer, because unfortunately some individuals still have discomfort or pain after surgery. But what I like most about it is that the way technology has gone, there are many type of treatments that can be utilized to reduce this type of pain. One in particular is spinal cord stimulation. That is essentially where we would like to say an electrode, or a row of tiny electrodes are placed near the spine that allow the brain or the sensation of pain to be what we call modulated or changed. So one doesn't perceive pain, it's more distracted by a different type of pain. I could go more into detail, but if that is something that may be needed, please come in and give us a call.
Absolutely. So is the majority of what you guys do here spine related?
The majority of what we do here, yes, I would say is spine related. However, we have the capability of treating all aspects and types of pain. If that's joint related pain, shoulder pain, knee pain, ankle pain, even if that's generalized, what we call widespread body pain, such as in fibromyalgia, we have the capability of treating any and all aspects of one's pain.
I love it. And then I know that I mentioned this at the beginning of the interview process, but you are double board certified. So to the general person, what does that mean? How does that make you an expert in what you do?
So when we seek board certification, first and foremost, we have to take part in a specialty. My specialty is anesthesiology, where yes, we take individuals to the operating room, and we provide the subconscious state that allows the surgeon to perform his procedure. There are many different types of what we call subspecialties in anesthesia, one being pain management. In order to be to go into pain management, one must take on a fellowship. So I had the opportunity to take part in an anesthesia residency in the Medical College of Georgia, and then proceed with a pain management fellowship at the University of Iowa. I also took part in a separate fellowship for acute pain in the University of Pittsburgh Medical Center. So I've had the opportunity to see in both aspects of pain, not only in the acute setting, but also in the operating room and in the post-operating room and long-term. When one seeks board certification, there's some rigorous exams one must pass or to study for and to pass. But what separates us apart is that we're considered the experts in the field, and we constantly continue to learn and try to improve our ways on how to treat pain. It's been a great experience, and the opportunities that have taken place during the training period have allowed me to be able to better treat my clients and be able to provide better care overall.
It sounds like a lot of school. How many years have you spent getting to where you are now, educationally?
15 plus a couple years after high school. So it's been a great journey, and I'm going to continue to enjoy it.
How many procedures do you think you've done in your time?
I would have to say thousands.
To the tens or to the teens?
It would probably be in the tens by now. Yes.
That's a lot. That is a lot. So this is an amazing facility, great personnel here, amazing procedure room or in-house procedure suite, as Dr. Webb calls it. So if you're in the greater Atlanta area and you are struggling with pain, be it from a slip and fall, a car accident, failed back surgery, as you mentioned, Dr. Webb would love to be able to help you get back to those things that make you feel like a person rather than just in existence at this point. So Dr. Webb, beautiful facility.
Thank you.
And I look forward to continue to learn more about what you do and sharing with everybody else how you can help. Any final thoughts?
Give us a call, and we definitely will sit down and work towards getting you feeling better.
Great. Thank you so much.
Thank you.